One thing that's certainly unique to human cognition is using language. Language is a means of communication that we use that developed from hearing. Over time, what happened over the course of millions of years of evolution, we developed apparatus for making sounds that other people can hear, and we developed very elaborate systems in our brain to comprehend the sounds that are made by other people as language. And by using language, we convey semantics, we convey meaning, we communicate with each other. Language plays an important role in our social integration and probably facilitates our social activity. You can imagine how productive that was, how helpful that was in adapting to the environment, to be so socially oriented, even to the point of having elaborate systems for communicating with each other using sound. Now, language probably started as naming things, and then it progressed to statements about naming actions, naming objects, and linking these together using other semantics. Mainly, language is all about naming. If you think about it, when you say something like, I ran across the street, I ran is naming a past tense for an action. Across the street is a phrase that describes the name of something. And basically what we're doing is conveying semantics to others that convey a restatement of an action, that convey, danger over eating something, that might be toxic in the environment, naming something that might be good for us to eat, and coordinating our activities so that we work together as a social group to do all kinds of things that adapt to the environment. Well, again, naming it evolved from hearing, partly, and it evolved obviously also from the motor apparatus in our face and our mouth to produce sounds, but it's all about sound. Language is really a sound-mediated communication. A lot is made about reading and writing, and I'll get to that in a little while, but reading and writing are only a few thousand years old. They're representations of the sound aspects of language still, and we often dissociate them as if there's some kind of special skill that's different than the sound, but it's all linked together. Well, here you see in this graphic a section of the head showing the structures that are used in the head and the mouth to produce sound. Now, obviously, what's not here, of course, is the brain and neurological system that mediates all of this. And we still tend to, even when we know that probably a lot of language comes from our brains, we still tend to connect it to the apparatus that actually makes the sound, our mouths and our faces. Language, though, is a brain function. It's not a property so much of the muscles and so on, the structures in our face that produce the sound, as it is the motor systems and the nervous system that mediate the production of these things. Well, the most important thing to see here is the pharynx. The pharynx is unique in humans in that it's so narrow compared to other mammals. One of the great reasons that we choke to death a lot is because the pharynx we have is relatively small. Things can't get down it. If you ever notice, when you give your family dog something to eat, they kind of, they can almost inhale it. They can take it down so easy. And that's because their pharynx is so large. Well, our pharynx is small because it facilitates the very subtle sounds that we make using our speech apparatus. So the sound that I'm making now to talk to you in this presentation is involving a complex apparatus here of my mouth and face and my brain to produce language-related utterances. These utterances are a communication to you about concepts and facts in a course like this, and you can learn a lot about properties of systems that you've never actually observed directly yourself from me telling you about them. Well, imagine how productive that is, how helpful that is, how it makes that so much more efficient in dealing with the environment when we can communicate facts and concepts without actually having to be there. So if somebody in the ancient past, discovered something that was good to eat in a certain place, they could go back to the group and explain where this food was and how to get there and so on, without the people having to go experience it directly. This made us probably the most productive, the most environmentally adaptive of all organisms on the planet. We clearly have dominated the planet Earth ever since we got language. And language enabled us to be so socially oriented that we just stood head and shoulders above other organisms in terms of how they could adapt to this world. It made us what we consider intelligent. You can't be intelligent without language. You can have various degrees of it, but when it comes to really being intelligent and being able to adapt to the world using concepts, reasoning, and so on, you have to have language. Animals that don't have language can be quite bright. I mean, your family dog's a lot brighter probably than, a lower mammal would be. But still, the dog and the human are just head and shoulders different. And there's no way escaping that. It's because the dog doesn't have language. Now, dogs have good social behavior, and if they had language, they'd be very adaptive. But they don't have it. And humans, at some point in our evolution, we began to communicate so efficiently using sound that it developed into the thing that we call language. And now it's developed to the point where we're completely facile with it. We don't even think about adapting to the world without it. And we've even developed systems all the way through to digital electronic systems like I'm using now to store language, to communicate with language across the ages. Presumably, if this course ever becomes all that famous, I'm not sure it will be, but imagine if, 100 years from now, someone wants to learn this, they can go back to my presentations and hear them again in language, the same way that you are today. And that's a remarkable thing, that we can store language over the course of generations and use it in the future, even when those people have long been deceased and are no longer communicating directly with the students of the present. At any rate, language is, however, for the purpose of this course, language is a development of sound and sound perception. It's a very unique application of sound perception to communication. It's enabled us to be very adaptive. Okay, what happens when you produce a sound using your speech apparatus? How facile are we really at it? I imagine if, we didn't develop from primates or mammals, other animals, dolphins, for example, probably have the innate capacity to produce much more varieties of sounds than we can. We're trying to use a mouth apparatus that was designed, obviously, originally for consuming food, and now we're trying to adapt our tongue and our mouth movements to produce very complex sounds. Well, here you see a graphic that shows the production of phonemes. Now, a phoneme is the basic element, the basic sound element of language. So phonemes have consonant, vowel shapes to them. If you think of a name like Hahnemann or a name like Drexel, it's got sound elements in it that are combined to form the utterance associated with that name. Well, we produce very small pressure changes associated with these sounds. Now, a vowel like ah is a very soft sound. We call it soft because it produces a very low pressure modulation, pressure changes, whereas a sound like pa is going to produce a very sharp sound in the beginning, a consonant sound, and then followed by the ah sound. So pa becomes a phoneme with the pa part and the ah part. So pa becomes a phoneme, a basic element for a number of different words. The formant represents the most characteristic aspect or the most characteristic part of the phoneme. It's the dominant frequencies that are in a phoneme. So if you remember before the spectrograms, and I see what you're seeing here is spectrogram, another kind of spectrogram. You can see where frequencies are on the vertical axis here, though, and intensities on the time in the shape of the word, or changes in frequencies. Essentially, the time of the utterance is on the horizontal axis. The darkness of the graphic depicts the intensity of the frequency. I know this is a little bit different way of depicting this. This kind of gives you a graphic, grayscale sort of picture of a sound utterance. It's better often for depicting sounds like language over time because they're complex sounds and they, of course, change over time. So here you see looks like they're a spectrogram of saying had. So you see the HAD down below there, and then you see the intensity and the frequency changes associated with that. So you can see that a frequency that's pretty low is present throughout the entire utterance. Actually, the upper frequency looks like around 1600 is also present pretty much through the entire sound. But then the duh part is probably that 2200 frequency that you see on the end there. The formants are the dominant frequencies where the dark areas are. And I'm not sure what the significance of a formant is except in defining what a phoneme. It helps define what a phoneme is, and it probably helps define it certainly must relate to the type of sound produced. But the entire phoneme together is the important speech element. And even though it's got dominant frequencies, the sound of the entire phoneme is just as important as frequencies that make it up. Okay, on the left there you see a frequency change. See how there's amplitude on the y-axis and frequency over time. So when the person's saying, I guess that's his I or E, see that they're just showing an I over there. That's probably I. No, maybe it's E. I'm trying to think where the tongue, how the tongue is shaped. It could be I or E, I guess. I guess it doesn't make that much difference. But you see what you've got there is a kind of, almost in a certain sense, a pure tone with an overtone. So you've got a frequency, a dominant frequency that's kind of low, then a frequency that's in sort of a very standardized interval after that. It's lower in amplitude, but it looks to appear to be a standard interval. So that's probably I. I, like that. The one below is U, or oo. That's also very much like a standard frequency. You can see with the vowels are producing very much like a pure tone, or similar to a pure tone. Obviously, speech is never going to be pure. So speech is never going to have the purity of, say, a tuning fork or a musical instrument even. Speech is going to be very sort of muddy and dirty. The sound is going to be complex. And what you get here, however, when you try to make a pure tone, you're going to get pure tone with overtones and then a lot of little frequencies in between that represent the unique character of your face and your mouth and your voice. And obviously you sound differently than other people. And that difference is going to be reflected in these small frequency changes that vary around these large dominant ones. Well, now speech comprehension has some interesting aspects. There have been great attempts to try to get computers, for example, to understand human speech, and it's been very, very hard. Mostly because of the two problems that are mentioned here, the segmentation problem and formant transitions, and the speaker variability problem. So here you see a spectrogram in which you've got frequencies along the y-axis, and then you've got a phrase down below, Roy read the will. Now, it's hard for computers to figure out, for example, the separation between words. It's hard for the computer to figure out, certainly, the separation between phonemes. So when you do formant transitions, which is the dominant frequencies changing, it's very hard for computers to detect exactly where the formants made their transition because the transition is always seemingly so gradual for many words. And so when you change your phonemes, either to express, something like past tense or future tense or something like that, it's hard for the computer to pick up where that formant changed and what it changed into. Humans don't seem to have that problem. When we listen to other people speak, if they're in our language that we've practiced, we generally understand them accurately, 99% of the time. We can definitely segment words well. We don't have any sense usually that, where one word ends and the other begins. As you listen to my voice now, you probably have no even a sense at all of even trying to understand me. It just happens so implicitly. There's also the speaker variability problem. If you have speakers, different male speakers, for example, men tend to speak at lower frequencies than women do. If you have a set of speakers, you have 10 different speakers, it's hard for a computer to tell them apart. And the speakers have variability that produces difficulty for computer models to handle. And what ends up happening is the computer, of course, just guesses or makes probability judgments about utterances, and they're way off what humans do. Usually, people can distinguish each other speaking, even if they're complete strangers, or sometimes maybe it helps if they're strangers. But if you hear 10 different people speak, you can recognize them pretty well if they speak later. You can make distinctions between these small changes in formant transitions and small changes in frequency differences between people without any trouble at all. For computers, this causes great trouble in trying to figure out what people are saying and how they're saying it. Because even if I just have a different accent, a southern accent or something, certain words are pronounced very differently. The computer, when it's analyzing dominant frequencies, hits these transitions and has no idea what's going on. It would prefer that everybody says things exactly the same way with the same intonation, and then eventually can figure out where our words are and do this transcription for us. At any rate, segmentation problems turn out to be a big issue in a computer interpretation of language that humans don't have hardly any trouble at all with. Every once in a while, you'll have trouble with people blending their words together, but that's usually because they're not speaking distinctly. And if a human speaker speaks distinctly, we usually have no trouble at all distinguishing words and phonemes. It's still quite a mystery exactly what the language center is doing and doing so well. It'd be nice if we knew, because then we could program computers better. Okay, along with the ventriloquist effect, we have the McGurk effect. And we have these illusions, these misperceptions, these misconstructions of our brain based upon the confusion between vision and hearing. Now, we have become very facile at identifying speech sounds partially by the shape of the person's mouth who's talking to us. Obviously, if you look at people for years and years and years while they're speaking, you're going to correlate their mouth movements and so on with the sounds they're making. Well, usually there's not a discrepancy. Usually people don't make mouth movements that are inconsistent with the actual sounds coming out, and we're all pretty consistent, at least in our own language. But a guy named McGurk, he figured out, well, what if I manipulate that? What's going to happen if I change make a discrepancy between what the lips look like when you're speaking and the sound that's coming out of the speaker? What will the person perceive? What will the subject perceive? And so that's what he's done here. Now, I have a movie at the website that illustrates this very well, and I'll just explain what you've got to do. It doesn't matter if I explain it to you, if you understand it. It's like the Ames room. When you look at the Ames room, it always looks normal, even though it's very distorted. Well, this always works too. Your brain wants to implicitly interpret all these things. So even if you consciously know what the word ought to be coming out of the speakers, you'll hear it wrong anyway. Okay, what you have here is an observer looking at a speaker, someone speaking on the screen. And what they're mouthing in their facial features is ga, ga. What's coming out of the speakers of the television is the sound ba, ba. Now, for some reason, some bizarre reason that no one understands, when you're put in that situation, you hear da, da. Okay? Now, it would be actually very interesting to develop more McGurk phenomena than just these with these simple phonemes. I bet it generalizes to whole words and things, but I've never heard that anybody has developed it any further than simple phonemes. Okay, what you're going to do is go to the next slide and go to a movie. The next slide has a depiction of the movie. What you want to do is go to that slide, then go to the website, download the movie of the guy speaking. When you play the movie, it's got a loop, and I'm not sure if I designed it so that it loops automatically or if you've got to set something in QuickTime to make it loop. But what you want to do is have it loop. And what's going to be looping is this guy's going to be mouthing ga, ga, but what's going to be coming out of your speakers is ba, ba, and you're going to hit da, da. Now, the way to really get this effect, really appreciate the mystery of it, is while you're looking at it and you're hearing da, da, close your eyes. When you close your eyes, of course, you take away the person in the monitor mouthing with his lips, ga ga. And when you do that, you will hear the actual ba ba sound that's coming out of your speakers. So look at him for a while, try to think of what he's saying, and then close your eyes, and it will change. Okay, here's the movie of the McGurk effect. You may be able to play this in the PowerPoint presentation because it's a very short movie. Otherwise, it should be at the website. You should be able to play it so it loops around a few times. I also may have designed the movie at the website so it does this automatically. It doesn't have to do this a lot. You will hear what you're supposed to hear, but it's neat to listen to him and then close your eyes, and you'll discover that your sound perception will change. The ventriloquist effect is a pretty simple concept in which there's always a sort of a rule that's axiomatic that vision will trump hearing when it comes to localizing things. So when it comes to particularly localizing sound sources, if you have vision in competition with hearing, whatever your visual system thinks to the sound source will be the sound source. And this is very compelling. For example, when you're looking at your computer screen now and watching this presentation, or if you go sit here and watch one of the movies, the sound is coming out of speakers. It could be coming out of, in your house. It could be coming out of speakers on your computer. But it's not coming out of the screen. Yet you localize the sound to the screen. And the sound source has to be pretty far from the screen before you begin to realize that it's not coming out of the mouths of the people who are in the movie on the screen. Well, ventriloquists use this. A ventriloquist, as long as he's not moving his lips to indicate visually where the sound source is, you will very, very quickly localize the sound to the object he's manipulating. It looks like it's speaking. And rather than explain this, I think it's something that you're familiar with. The dominant concept, though, is that vision trumps hearing. So in primates, vision is so important for localizing things, for telling where things are, that it trumps hearing. Hearing is a relatively weak system for localizing things, sound sources. And so vision is much, much better at localizing things. It's much, much better at mapping where these things are in three-dimensional space around your body. And so whenever you see a sound source that's possibly coming from an area that vision can recognize, vision will trump your sound. Now, if you close your eyes, you will localize the sound in the speakers. You'll localize the sound in the mouth, the ventriloquist. But if your eyes are open and you're looking at the dummy, in this case it's an apparatus he puts actually on a person, you will localize the sound to that source. Now, this is also a movie made by the Weird New Jersey guys, and so they went out to a ventriloquist convention and interviewed one of the ventriloquists, and you see him now participating in a show as a volunteer. Just watch the movie and you'll clearly see what I'm talking about. Vision will trump hearing. You'll localize the sound to the dummy, and it will seem like the dummy has intelligence and the dummy's speaking, when actually, of course, it's the ventriloquist. Okay, let's talk about what happens in your brain when you use language. When you produce speech or when you understand speech, what parts of your brain are involved in that, and how does this basic system work? It's obviously important to understand this, especially when it comes to brain injuries, understanding deficits of language that illustrate different kinds of illnesses a person might have in their brain. Well, the system is basically designed into a sensory and motor system. Now, if you keep in mind, the general rule of thumb is your sensory systems are in the back of your brain. Your motor systems, your action systems, they're in the front of your brain. Okay, secondly, remember that language is an elaboration of hearing. Now, the hearing centers are illustrated here very generally by the yellow toning. So when the auditory pathways come up from the brainstem, from your ears, they come into your brain at that point. They interface with the nucleus and the thalamus, and then they come up to the sort of, they're actually more inside the sulcus that you see there, but the superior temporal lobe is the area in which they come to the cortex. Again, the superior temporal lobe is laid out by frequencies, just like the cochlea and the basilar membrane are. Now, what's happened over time is these sounds now are going to be processed different ways, and so the brain has evolved systems for dealing with sound, and part of that system is dealing with sounds that are related to language. The language center, the language sort of comprehension center, is the red area, the sort of red-pink area there in the temporal lobe and the parietal lobe. This is the center that allows you to comprehend language that you hear. So it takes the sound elements, the sound spectra is being communicated by the ears, analyzes that for language-related sounds. Now, as you know, you're not born knowing English. You're not born knowing your language. You have to acquire a language that's unique for your culture. But you are born with a language center that has the potential to do this. So that's what's unique about humans, primates, is we have developed a center in our hearing system that allows us to incorporate a language. Now, when you want to say something, you have to use motor systems. You have to organize all these thousands of muscles in your face and mouth and your throat and your tongue to produce a subtle utterance. Well, this is presumably constructed. It's unknown exactly where it's all constructed, but it's probably constructed by the language center in the parietal temporal lobe. However, it could be constructed by the center that's blue there in the frontal lobe. But however it's done, it may involve the coordinated action somehow of these two centers. There's all different theories for how this has been done. But at any rate, when you want to say something, you use the center in the frontal lobe that coordinates your mouth muscles and your face muscles, your throat muscles, to produce language utterances. And I'll go into detail a little bit later about what happens when these areas are damaged, because it illustrates how they function, I think, when you see them, when you hear about them damaged. The green area there is referred to as the motor strip. That's where all the motor functions are for different parts of your body, and your face and your mouth are kind of down lower. And the language center for the motor system that deals just with language is the blue area. Now, the area in the back there, the occipital lobe, we talked about quite a bit under vision. The occipital lobe is obviously important for seeing writing, or enabling you to read, and also enabling you to write. It is very important, obviously more important for reading than writing, but it's important in both. Well, if you have a disconnection between the parietal area there that deals with language and vision, you'll have an inability to read. You have a primary alexia. And that's an obvious thing that happens when those two areas are disconnected. Now I'm going to go into a little more detail about each area. Here's an example of the kind of study that I do with language. Here we're going to be presenting subjects in an fMRI study with different language elements. They're presented to each ear independently. And so you're going to be listening to these independently and making a judgment about whether they go together or not. All these happen to go together. And so we're going to try to find out where semantic association areas are in the brain. So that's what we do. People in the scanner play sounds through the headphones that have these words in them, and then they have to think about whether they're related or not. And then we study what areas of the brain become active when they do this. Okay, when we do this and get all of our scans and do all of our analysis where we find out what areas of the brain are active and inactive by analyzing the bold responses, up top there you see the right hemisphere. In the right hemisphere you're basically getting auditory areas active. Remember, the superior temporal lobe is where you hear the sounds, coming from each ear. So the sounds coming from the left ear are processed in the areas that you see there. In the left hemisphere is where you get the language centers in most people. And here you see the same auditory areas active in the left temporal lobe, but then you see areas up in the parietal lobe that become active. As the person's trying to understand the words and comprehend them, you see areas up in the parietal lobe become active. Now you also see in the frontal lobe on the left side, Broca's area, or the area that I mentioned before that coordinates the production of speech. Now these people are not producing speech unless they might be doing it sort of subvocally. If they're sort of saying it to themselves, you might get, Broca's area active. Or if they anticipate saying something, motor neurons in the frontal lobes will become active. But basically what you see here are the language centers illustrated by fMRI methods that were the same ones that I described in a schematic at the beginning of this section. Here's the area in the left hemisphere that becomes active when people are just thinking about the meanings of words. So as they hear words and we ask them, okay, well, is the word you just heard related in meaning to the one you heard right before it, you get this area of the brain selectively active. Now, this is presumably the part of the brain that deals with memories about words, memories about how they're shaped and formed, as well as memories about what they mean. Here we remember while we're reading, if you see a word like K-N-I-G-H-T, you have memorized that that's pronounced night. And so but that memorization, that memory for that word form, that word shape, and how it's supposed to be pronounced, at least in our modern English system, is stored in this place. Now, the words like night, K-N-I-G-H-T, are actually an artifact of history in the development of English. The correct spelling of the word night should be N-I-T-E. However, over time, in our rigid, very strange, rigid belief that spelling should ever be changed, we have kept a spelling of that word that was actually developed at a time when people actually pronounced all those letters. And then over time, the English speakers began to simply say knight for the object, the guy on the horse. He was called a knight, but we rigidly kept the old spelling, and that turns out to be a problem for teaching reading. We have probably hundreds of irregulars in English that are reflections of this that should have been changed in dictionaries and never were. At any rate, the area of the brain that keeps these memories about word shapes and how they're pronounced, as well as meanings of words, is in this inferior temporal lobe area here. This is one of the most resilient functions to brain injury and brain damage. When you get brain injury and you get brain damaged, it's very unusual for somebody to forget the meanings of words. And it might be because this area of the brain is kind of protected because of its location from strokes and from brain trauma because it is an area that typically doesn't receive the trauma of other areas. Usually when you have brain trauma, you damage the frontal parts of the temporal lobe and the lower and frontal parts of the frontal lobe, and this area of the brain would be relatively preserved. It might be because of that, or it might be because the way in which this information is kept in the brain, even if it is damaged, somehow it has a resiliency that other parts of the brain don't have. Anyway, it's one of the great mysteries that we retain our meanings for words. We also retain our old memories. They're very resilient once they get remembered. So the things that you did when you were 6 years old that you remember tend to stay with you all the way through getting strokes, Alzheimer's disease, traumatic brain injury, anything that will damage the brain. These things will still typically be preserved. So this area here is an important area for comprehending semantic knowledge and for other information about language, other information about words. Okay, another area that I'm going to present is one that I've also studied, called auditory neglect. Now, auditory neglect and neglect phenomena generally involve the misperception of stimuli, the misperception of sensory information that's coming into the hemisphere that's been damaged. And so most people only have damage on one hemisphere and not the other. And you can have phenomena where, for example, in this case, the person hears a sound coming in the left or the right ear. Where the damage is, they'll tend to prefer the side that's intact, the side that's not damaged. And so in this case here, you've got somebody with the right hemisphere damage who's having trouble hearing sounds coming from the left ear. Because remember, there's a crossover. So sounds from the left ear go to the right hemisphere. Sounds from the right ear go to the left hemisphere. So, for example, this person with a stroke in the right hemisphere, if they heard the words, say, apple in the left ear and the word chair in the right ear, they would prefer what's being presented to the right ear, because their left hemisphere is completely healthy. And the left hemisphere is also the place where your language centers are. And my hypothesis was that if you present language information to both sides, that's interactive in the sense of it being semantically related or it's compound words or something like that. If it's interactive like that, the language centers will notice that and process the words even if the right hemisphere is having trouble hearing them. Whereas if the words are not related, so if you play two language-related sounds, two words, one to each ear, that are not related by semantics or something else, the language centers will not make that association, and the person will behave as if they have neglect. And so we did a study where we took patients with neglect, and as you see here, we played words like in the left ear and the right ear, like bass in the left ear and ball in the right ear at the same time. So you hear bass and ball at the same time, one in the left ear, one in the right ear, versus playing words combinations like chair and ball. So chair and ball appear at the same time, chair in the left ear, ball in the right ear. Now what we discovered was when the language was interactive, it produced a very large effect on perception. So when you played the combination chair ball at the same time to each ear, the patient would say they heard the word ball, the word that was coming in the right ear. If you played, however, baseball, so bass in the left ear, the word ball in the right ear, the patients would say they heard baseball. Because the language centers in the left hemisphere, which are still healthy, because all these patients had right hemisphere lesions, even though there's a degraded stimulus coming on the right side, it's language related, and it's related to the word that's on the left side. And so the patients will have a tendency to integrate these two together through whatever degradation is occurring because of the lesion, and they'll have a much more accurate perception. This also indicated that phenomena like neglect are often related to the kind of stimuli that the patient is presented. And there is no sort of standard set of stimuli that's going to produce neglect consistently in every person in the same way. It has to do with what processing centers are still intact and which ones are damaged, and how they interact with each other and interact with the stimuli that's presented. This represented an interesting application of sensory perception to the study of brain lesions. Well, one general syndrome that occurs associated with language is when you have damage to these centers that deal with language. What kind of symptoms do you have? How does that illuminate what language is like? Well, back in the 19th century was when this study first began, and what happened was, at that time, you may have heard of a group called the phrenologists. The phrenologists were probably the dominant theory about how cognitive functions were localized in the brain. And even though today usually most people do not think of phrenology in that way, the phrenologists were primarily anatomists. They were brain anatomists. And the kind of analysis they did later of personality and things like that were all related to their theories about how what they referred to as organs were localized in the brain. Well, one of the things they had localized was language in the left frontal lobe. And this had happened, I believe, almost by accident. It may have happened, no one knows why the phrenologists localized language there. It may have been because there were early cases of aphasia and they localized it that way. Or it may just have occurred by accident. But there was a famous wager that was made by the phrenologists, and the wager was that if somebody could find a patient with a left frontal lobe lesion that did not have impairment of language, then they would win 500 francs. Now, this is the French Academy. And a neurologist, a physician really, in those days they weren't so refined or specialized, a physician named Broca, he was very intrigued by this, and he knew some patients in different clinics that he worked in. In particular, one had a very compelling disorder of language, and he died soon after this interest was generated by the bet. And Broca went and examined him and examined his brain and discovered that sure enough he had a defect, probably associated with strokes, in the left frontal lobe. Well, Broca discovered a few more cases before he reported on this, but basically reported that you have an aphasia, you have a language disorder, with a lesion of that blue area that you see in the diagram here. Now, the patient that he studied, the most famous one that he studied, is nicknamed Tan, because that's all the patient could say. His real name was Leborn. And all Leborn could say when you asked him a question is just the phrase, the utterance, Tan, Tan, Tan. So if you asked him, how are you doing today, he would say Tan, Tan. And I had a patient in my training who was similar to this. All these patients that have this kind of manifestation of this kind of aphasia, Broca's aphasia, not all Broca's aphasics do this, but the ones that do this all have a stereotypic phrase that's complete nonsense or gobbledygook that's very short usually. Now, Tan's utterance actually isn't gobbledygook. It is actually a word, but probably in the context of his aphasia, it was a made-up word, even though it actually does make an utterance. It was probably the frontal lobe's last attempt to make an utterance turned out to be this linking together of those phonemes. Well, the patient that I saw many years ago, all she could say was Ichabodi, Ichabodi Ama. And I'll remember that phrase for the rest of my life because that's all she could say to any kind of question or anytime anyone asked her to read or anything like that. All that would come out was Ichabodi, Ichabodi Ama. It was the most amazing thing because she could inflect her utterance so that it conveyed the proper sort of social context or emotion. So when she was unhappy or she was frustrated, it would be Ichabodi, Ichabodi Ama. If she was just saying something matter-of-factly, it would just be Ichabodi, Ichabodi Ama, as if she was answering a question you asked her with that phrase. Well, what's happening here is the frontal lobes cannot coordinate to produce language utterances. Now, patients with this syndrome can understand what other people say to them. They can read. They have a really good facility for language comprehension, but they are unable to produce utterances, so they have trouble expressing themselves. Now, this was an amazing thing and gave rise to what we consider today behavioral neurology and neuropsychology. Now, a few years later, a neurologist named Wernicke, he discovered a series of cases in which the patients speak in complete manufactured sounds, utterances that are complete nonsense, complete sort of stew of phonemes that make no sense at all. But they come out very fluently. They come out as if the person's been speaking like this their entire life. It comes out very, easily, even though all the words are complete inventions. They have no meaning to the hearer at all. The listeners can't distinguish these at all, and the patients also cannot make any sense out of these. However, their intention is to produce languages that they always have. And often patients, even though they can't comprehend themselves to sort of check that they're making all these mistakes, they will behave as if they're speaking correctly and all the people around them just can't understand them. Well, this kind of aphasia was referred to as Wernicke's aphasia, and it results from lesions in the area in the parietal lobe, that red area there. This is probably a true loss of language in the sense that that center is probably the center. Since it's doing the comprehending of the sounds, was the center that evolved and to be essentially the language center. Because comprehension is the core of language. Producing utterances, you can, of course, use a lot of language without producing utterances, and that's what that center does that's in the red area. If you lose that, though, not only can you not comprehend utterances that other people say in language, but the ones you produce are all confused and disordered and aren't conveying any meaning. Well, this became remarkable, these findings. It really did establish behavioral neurology. In these days, of course, when patients come in with strokes and they have language impairment, a lot of attention is paid to the kind of lesions they have and the kind of language impairment they have and correlating those two things to really ferret out where the stroke is and how it's affected their function. Obviously, language is very important for people. If you lose your language, imagine if you lost your language. Imagine if you lost your ability to communicate. Not only do you lose your ability to communicate, but you can't read. You can't understand your own internal speech. There is no internal speech. Your ability to use language intelligently can be completely gone. It's not like you become deaf. It's not like you become somebody who's mute. You become somebody who no longer has language. And language is such a core of human cognition, it's almost as if you've lost part of your humanity itself. Language is, of course, mediated by the brain. It developed from hearing. It also involves producing sounds, but it's a sound-driven system, and so it's a hearing-driven system. Well, at the website, I have some nice movies that depict different kinds of aphasia and this entire sort of history. And rather than explain it in any more detail, just go ahead and watch the movies, because they have examples of aphasic people, and you get a clear sense for what this syndrome is like.